Hi, it's Dr. Andy. This is episode 13, which I think is quite appropriate, an unlucky number 13. Because I am home right now, isolated with COVID symptoms. I thought I should share that with you. So to explain a little bit why this episode and the next one are in my bedroom and the lighting isn't as perfect. Well, it's never really perfect, but not as good as helps you to understand what I'm talking about. But I wanted to share this with you. I don't have a positive COVID test. I'm highly suspicious based on the symptoms and how they presented in the timeline. But I'm waiting to get a test. And so that's one of the things I wanted to just bring to our thinking about is some of those issues that are happening. One of the problems here, I got sick, realized yesterday that my symptoms were very possibly COVID. Tried to call to see where I could get tested, and the first day that I could get tested was 3 days later in the afternoon. And then at the same time, I also know from what I've seen from patients getting tested that it will be a little while to get the turnaround. So I said, when would the turnaround be expected? And the earliest would be 4 days. Most likely it'd be more like 7 days and possibly up to 10 or 11 days. So from a public health standpoint, that doesn't do much good. We need to be able to test people quickly, get results quickly, so that we can start the contact tracing, so we can put people in quarantine and stop the spread. And so I wanted to just point that out and bring that, highlight that issue that is still going on, that we really need to be figuring out ways to make sure we can test people and that we can get quick results to them and that we can engage in the contact tracing that will identify their contacts. In my case, here I am with these symptoms. I'm treating it as if it is COVID-19 to be safe. I'm going to stay isolated until I'm symptom-free for 3 days, and it's been at least 10 days since the beginning of my symptoms, and those are the general recommendations for this kind of a situation. And just hope that those people I've interacted with in the past few days don't end up developing symptoms. I, for the most part, really try to follow the guidelines. I go to work and I stay in my office and I use a mask and I minimize my contact with others and use protective equipment. And so we really hoped we were doing everything we could. I'm confident that my risk was lower because of that. For anyone that may be thinking, well, this shows it doesn't work, that's not true. No one ever claimed that using appropriate PPE and using all the guidelines we have reduces your risk to 0. But we know it reduces it from where it started. So, so if you put 10 people like me in a box and you expose them all to COVID, then and we all used the precautions that I used, then a smaller percentage of them would get it than if we didn't. And that I'm absolutely confident based on the evidence that is the case. So I'm confident my risk was, that I had reduced my risk, and so that's why I can be comfortable with this. Of course, I'm relatively young and healthy, and hoping that this won't turn out to be too bad. I think I may have already turned a corner. So a little fever and body aches and slight cough, and I think I'm coming around. It wasn't pleasant, but it wasn't horrible for me. We'll see in the next few days, and hopefully that continues. But this is my unlucky number 13 episode for you, and that's me today, Dr. Andy, unlucky number 13, trying to teach you some principles about public health.